Hey everyone, welcome to Caring Together Northumberland, a series of podcasts giving you a chance to listen to what's happening across Northumberland to transform health and care.
Hello and welcome everyone to another episode in our podcast series of Caring Together Northumberland. So I'm joined by two very special guests today. First one is Tara Twigg-Robson, who is Commissioning Manager at Northumberland Clinical Commissioning Group, and they hold the purse strings for Healthcare Northumberland. And the second guest today is Emma Richardson, and Emma is Strategic Lead for Northumberland Communities Together and Poverty Lead for Northumberland County Council. So pleasure to have you both here. Welcome. So Emma, I'd like to start with you today. Tell me a little bit about your role. That's quite a title you've got there. Tell me a little bit about what you do.
Isn't it? It's quite an exciting and innovative role as well. So I've been at the County Council for 4 years, and initially my role was really about working together with and in communities to understand how we best support around inequalities and hardship, and that's from the bread and butter day-to-day stuff around access to good information about welfare rights and things like that, right the way through to prevention and enrichment, which we know changes life chances. And that meant I was working across lots of different teams, the locality coordinators from public health who did the mapping and tying community supports together, and different pieces of work like that. And then when the pandemic hit, of course community came into sharp focus, and a lot of that preparatory work was so important to bring together our response as a local authority to ensure that actually we all stayed safe and well by working together. And what we learned through that was developing Northumberland Communities Together as a service, that when we worked together and took down barriers and worked towards that shared ambition, we could achieve a lot. So from there, we've continued to build on that, hence the second part of the role as strategic lead for that work, working in and with our communities to build different solutions to some of our biggest challenges.
And what would you say some of those challenges are?
It's complex, and I think that's one of the things that we've learned is one thing does not solve one problem, and lives are complicated, as we all know. So even this very simplest of thing, thinking about the start of the pandemic, when a shortage of food and food insecurity was much more complex. It was people getting shops, it was volunteers, how to manage payments, and then isolation, why people are isolated, why people don't engage with things that are there. And a lot of the time it's about understanding the glue and the golden threads and the relationships and the way communities work at that most local level to be able to develop solutions together with communities, because we can put great stuff in, but it can feel a little bit too much for people in that moment that they need something. I always think it's like with yourself, and what do you need in your tough times? You need your best friend, you need a nice cup of coffee, you need somebody to listen, you need a gentle approach, and it's no different when working in and with communities around some of those big challenges.
Just picking up on what you said there about being the glue, the golden thread, I know the CCG has at times been referred to as the glue in the healthcare system. So Tara, how does CCG tie into this communities together, working together?
So I think previously, many years ago, I think as a health service, we've appreciated the voluntary and community sector and working as a system with the local authority around supporting communities. However, I think over the last couple of years, things have moved more from a transactional relationship with the VCSE to more of an actual co-design and co-production work relationship. And I think one of the elements that moved the health service on was the introduction of primary care networks, which are obviously groups of GP practices that have come together to work and provide healthcare for their local community. But one of the roles was around social prescribing, and I think for the health service that's really highlighted the need to work with the voluntary and community sector as well as the local authority around meeting the needs for people rather than just thinking about healthcare. And I think the pandemic has obviously highlighted the need to address the inequalities that not only were there already but that have now been exacerbated by the pandemic. And I think it's just really put the spotlight on how we all need to work collectively to look at the foundations of people's health in the community in order to make or improve their health but also maintain their health. So I think I think the NHS and certainly, you know, locally we've probably come on we've had a slightly longer journey, I think, but now I think it's all absolutely recognised that it's all of our responsibility as part of a system rather than, you know, just us having a transaction with the VCS to provide a service. I think it's about now it's working with them to understand what will help improve their health and empowering them to improve their own health.
So we're going to do a bit of jargon busting. VCS, what is that, Tara?
That's the Voluntary and Community Social Enterprise sector, so VCSE.
So tell me a little bit about that sector. What do they do?
I think Emma's probably best placed to talk about the...
They do everything and anything, and it's quite often perceived to be a free sector, but it's everything from a flower arranging group, a gardening group, right the way to emergency food provision. They also quite often have not-for-profit business models around housing and different size and scale. For example, Age UK are a big, huge partner, and so they do everything and anything and actually do it really well. And one of the strengths of the VCSE sector is that they are reactive, responsive, they're quick, they are resource friendly, and they're hyper local in lots of ways. The expertise that sits there, they are a very different way of working to statutory and anchor organisations, but really fantastic partners to have, and feel they're innovators, they're entrepreneurs, they're talent, and a lot of things that I think we don't often associate because we always think about the activity that they're doing rather than the work around that. And as Tara rightly says, that system stuff that supports and develops that work to exist. And in the last year and a half, we've really seen that come to the fore across all those challenges where there has been a local response that's been strong and effective in that well-being world that we are striving towards.
Yeah, of course, when you say it's the NHS and that sort of voluntary sector working together, that's got to be better for the person's overall well-being. It's not just about treating an illness, it's about helping the person to live the best life they can.
Yeah, I think, you know, we understand the wider determinants of health, and is it around 20% of healthcare that actually has an impact on someone's health? It might be 20% or 40%, I can't remember.
I think it's 20.
Yeah, I think it's 20%. So really, we need to be supporting the community or, you know, the relevant sectors to help develop housing, food, education. It's all of them factors that have an impact on someone's health. So we're only, you know, touching the tip of the iceberg if we try and just address it through, you know, hospital services or GP services. We're just, you know, you're not going to make the progress, and you're not. I think the way things have moved on since the pandemic is a massive opportunity, and like timing wise, I think it would be a massive waste if we didn't all work together now to build on all of the progress that we've made since COVID has hit.
There's something really important about health and what we mean by health, and when we mean healthcare, and when we talk about prevention and enrichment and being socially connected. A coffee morning once a week is a health intervention, but do the people who are organising that recognise that? Does the system recognise that? We forever discuss knit and natter, and I did say to Tara, please don't let me say knit and natter, but I've said it anyway. We discuss that as do the people who attend that know it's a health and wellbeing group? No, and it's not that important, but it's important that the system recognises that, holiday activities, after school things, breakfast clubs, parks being well lit, a bus that can take you in and out, all of these, the employability, the good work pledge north of Tyne, these are all things that contribute to how well people feel, and that's in those wider determinants. That's where the system, we've all got a part in that jigsaw to play, and that includes our population at large, so our residents saying hello to each other, making a point of using the community cafe every now and then so it sustains, that responsibility sits with that. When we talk about the system, it's every one of us, as well as the big organisations and the little ones.
I think it's, as statutory services, I think we've got a role in facilitating space and opportunity for communities to develop. It's not about us, you can't create the community for them, it's about us giving them that space and chance to build that within their local communities.
Absolutely. And so in Northumberland, of course, we've just launched our first community hub in Cramlington, and the plan of that is to really stretch and challenge communities together with us and see how do we create those spaces. But there's a real capacity building and connecting and partnership working and trust and all of this kind of work that needs to happen with that landscape, and that's with our own workforce, it's with our community sector, it's with our funders, it's with our residents, and really that it's a journey and it's not quick. And Tara and I had a light catch up ahead of this, and we were saying if it moves quickly we're probably not doing it right, because we need to make sure that we're just checking those corners and those closed doors and those wardrobes to be having all of those conversations in all of those places, particularly in Northumberland, which is, geographically is a big challenge, but there is something around acknowledging our starting point and some of that strong work that's coming through. And I think that's one of the big changes that we're seeing in the system, that the system is ready to recognise the starting point we're at to start with everybody, and that's a really important point of this work.
Absolutely. And I think some of the key areas of work that obviously we'll get onto, I think we've really seen a difference in how they've been approached from the beginning, and I think that just feels so different already. But it kind of is, it just sets the ball rolling, and it's a little bit of a snowball effect. I think I see them little, I say little projects at the moment, they seem like little projects, but they're right at that beginning of that snowball, and I just feel like we need to build it and bring everyone with us, and we've got them, they're kind of the vehicles to do that.
There's so much storytelling. It's great to be here talking about it, because actually a big part of the work is the communication of what you're doing, and also we keep using that word system, and I'm thinking, what does that word mean when we say system? And basically, I don't know what it means to you two, but to me that means we've all got a bit, and actually we all need to see that bigger prize. And to go back to COVID, one of the things we've learned most sharpest in the last year is that when we are working towards this agreed priority, let's stay safe and well, it's amazing what we can achieve together. And that includes at the most local level, as I'm walking my dog and I say hi to my neighbour, you're all right the way to the way that we make sure that organisation that is doing that key piece of work knows they can ask us if they need somebody to pick something up from the fire station or whatever. We need to be ready to work and play together, and that's my understanding of system, because I did wonder, but we're using that term, what does it even mean?
Yeah, I would agree. I think when I think system, I just think all of them parts of the system are the different organisations, the different groups, but also the communities and the residents. We've all got a part to play in that whole system. We're all cogs in the in the engine kind of thing. So I think we're all everyone's got a role to play, and so everyone needs to has some responsibility to make that happen. Like we've said before, if it was easy, we're not doing it right, because I think we would have done it already. There's a reason why it's taken a little while to get to this point, and the pandemic has really just really pushed fast forward button on all of that. It's forced some change,
definitely, and we've all taken a bit of ownership of being well. And that's the thing, isn't it? What we're seeing is, how do we all take ownership of being well, and do we all understand what we mean by being well, and do we all have enough understanding of what it is that's contributing? So as Tara said, healthcare 20%, transport, employability, safe places, opportunities, that's part of that. So actually, where's our part in that to play, and how do we make sure that isn't a barrier, especially that's then speaking really as a local authority, where a big part of it is unpicking why is that a no, how do we turn that into a let's do that together, how do we turn that into we'll do it this way, to actually let's revisit the brief together, and that working togetherness is hard, because we meet differently, we work at different paces, we're funded differently, we measure differently, we have different restrictions and sometimes different policies, so it's a huge challenge. But with that determination that we've shown we can do, it is there for the longer term planning to really make that difference.
I think, how can we, we've commissioned, historically we'll have commissioned the voluntary sector to provide a service, for example, but how can you expect kind of an organisation or a group to provide a solution if they haven't co-designed the solution? So I think that came from a GP in a very recent meeting, and it just really resonated with me, actually. And I think, that just absolutely is right. You can't expect someone to solve it if they haven't been part of how we get there.
And not only that, but to go back to the first question you asked about what are those inequalities, and actually we can't put them in a little tick box. It's actually the air we breathe, it's the place we're in, it's the life we've lived, it's the genes we've got, it's the relationships we've had, and all of those bits and pieces, and from that, so to form those responses that we can commission, the likelihood of that being single organisation should be nil, because we know there's a bit of hand holding, there's a bit of signposting, there's a bit of communicating, there's a bit of quality assuring, there's a bit of it should be held in place by a number of threads, so that for the resident, for the person, it should be simple and almost natural and within the fabric of their life, as close as we can get it to that, so that in that earliest moment those opportunities are there. And that starts, of course, with the best start in life, and wee ones having nice places to play and good quality education and all of those things, and hobbies and things that we know increase wellness, and then building on from there across the lifespan.
So I just want to go back to Tara there. So traditionally you'd think of the CCG as sitting officers deciding what money goes where, and it's not like that at all, is it? You play an active role in the community, you get fed back that information, and you really have a duty to know what's going on in Northumberland, to know where that money goes.
Absolutely, in terms of value for money, but also for outcomes for patients and the people of Northumberland. So you're absolutely right in terms of working with the local communities, and I think we've recognised that we'll be able to do that in an even stronger position by working alongside the local authority and Northumberland Communities Together. I think you've got the local authority and Northumberland Communities Together have got a very they've got that established relationship that I think we're trying to work with Emma and all the relevant teams on, rather than going it ourselves and duplicating efforts. And why start again, try and do something from scratch if we can actually all do it together? Because if we've all got the shared ambitions, then we should all be working towards them together, rather than I think we've just learned that like we've just been talking about in terms of the outcomes, there's no individual organisation that can meet all of them outcomes that we need for people. So we might as well work together on working with the community if we're looking to achieve something collectively to meet them aims, really.
I think that's a really important point. And Northumberland Communities Together, which, in case people don't understand, it came up from the pandemic, but really the reason that it exists is to facilitate partnership, collaboration, co-design, and kind of broker relationships across different places and themes, to be able to bring those thoughts together, and how do we support Tara's reporting? So when she's commissioning something, what do we see that's when we talk about collaboration at an operational delivery place, but there's also collaboration at a kind of system measuring place that's important, like how do we know we should do a piece of work there? What would we hope to see? And we say, actually Northumberland Communities Together would see that, because Tara is part of that jigsaw, that shared reporting that we have, that tells a whole story, which fundamentally is also really important for our communities and residents to see their really integral part in that landscape, because ultimately that's what we spend most of our time doing and being and experiencing, isn't it? Yeah. And so when we tell the stories, it is about telling the whole picture, and it's a much lovelier story, and also a much more honest story from which we can then build more work together again. So it's quite organic as well.
I think that's the most relatable part for people in Northumberland that are listening about joint working, is there's nothing more frustrating than having a bit of your care here and then you have to go somewhere else for this bit, and them not being joined up. And I think we've obviously all experienced it, whether it's some kind of insurance, or where you're being passed from pillar to post. I think it's really important that we recognise, and obviously, we're all humans, so we understand that lives and our health and well-being isn't linear, and actually, it can go up and down, and it's making sure that services and systems kind of are flexible enough to meet the needs of people as and when they need it. It's not seeing the VCS as a safety net, and I think that's always, you know, with you go through the health service and you might need some local authority support, but then you go to the VCS and that's your safety net. And actually working together around proactive support and what's needed in the community is actually recognising, and I've heard this on a conference, but it's seeing them as a trampoline, and you know, it's supporting them to get back or even in a better place than they were before.
So I guess I like all the analogies coming through. It's really helping me make sense of, you know, the system, the cogs. I really like the snowball. So tell me, all these snowballs are on this journey. In the next year, what would you like the snowballs to look like?
Okay, so I think the first one is the referral system. That has been a really exciting thing to be involved in, because the idea around a referral system kind of came from two different points. So it came from the VCS, and they were starting to work on something, and it came from the health system, you know, with the local authority, and there was some discussion around needing something, and actually the conversations were brought together, and we've co-designed a solution that is pragmatic, because, you know, recognising that the voluntary community sector is so varied in terms of size and capacity, so we need to make sure things are, you know, real for them and, you know, simple and just fits in. It's all proportionate. That's always the thing, I think, for the VCS, but it meets the needs of other services and people, communities and people like that. So this referral system, we hope to launch it in a few months' time, and it will be a directory of service for Northumberland. We'll have some priority organisations and groups on there to start off with, some of the key groups that are commissioned and referred into regularly. But by next year, I would hope to see that really established and growing, and we would hope that it's seen owned by the whole of Northumberland. It's not a health referral system. It's not a local authority referral system. It's people can self-refer using it. Voluntary community sector services can put their services on there. They can choose to receive referrals. They can refer to each other. I think I've got a really, you know, my vision is that it's the go-to place. People will know its name and think, oh, if I need something, I just need to look on there. That's certainly how I see it. It's really exciting, I think.
I agree. I mean, I think a universal directory referral system where all of our information is on, and culturally we hope that, you know, that buy-in, we build that across our system, our funding and all those different bits and pieces and across the VCS sector themselves, who are keen, because it's come from them as a consortia, as a proposal, and from there, you know, people will be able to self-serve support, because one of the other things that's really important is universalism, and that should be proportionate. You know, Tara used the right word there, that we do need to drive resources differently across different parts of the county, but we also know, and again we've learned in the last year, that you can't always predict who's going to need the support, and it's really important that that's visible and accessible in many different ways. So the idea where you have that in a place with the support of all of the different, whether it's a funder, whether it's a network that exists across the set, whether it's a CCG, that's actually, this is a go-to place. We use it. It's alive, it's dynamic, it's organic, it's inclusive, and it's proportionate to the size and scope of the organisations and services that we've got, is quite exciting. And I think the other side of it is it also gives us a bit of consistency and something that can tell the story of what is happening across Northumberland, and we're a bit concerned about that, that's really strong, I wonder what we can learn from that, or do we need to invest a bit more in this, or do we need to look at that differently, and that's quite exciting, and they're interesting conversations that then we take forward into that cross-sector working to see, well, what are we doing next, what are we learning, and what are the messages that this is telling us, and we don't have that at the minute. But the other side of it as well is that people can pick and choose how they engage with that, that's appropriate to them and their life, rather than us making the assumption everybody needs this pathway or that phone number or that member of staff, because as we all know what we need, and it's about finding that and making it easy. So yeah, it is exciting, the referral system.
We'll absolutely support someone to, you know, take it upon themselves to go on the system. It might be that, you know, they've used the system maybe with a person in a service beforehand, and they thought, oh, that's a you know, I can find anything I need on there, and, you know, then maybe look at it at home, or will hopefully have an app as well. So, but obviously, you know, like Em says, I think inclusivity is obviously one of the key elements as well. So it might not be that someone has access to it, you know, they could still access it through a professional, depending on who they're getting support from. So, you know, there's options, but it absolutely is the aim that someone will be empowered to use it themselves and access the services that they feel they need. But it might be that they don't realise that there's all these opportunities out there, and so this can kind of open that up to them as well. It's not just about looking for something that you know is out there.
I think it's a really important point. You know, to go back, we did touch on well-being being everybody's. So you know, and there's something about the content and the activities and services that are on that platform to include those social activities that we know. So it does bring us a little on to volunteering, because we know volunteering is a reciprocal activity, and that people, when they're connected in the community, they do well, they get support sooner because they're connected, and all those other things. So it's about us setting the tone of the referral platform to actually be a wider directory that recognises that life should be coloured in lots of different ways, bespoke by your own choices and the way you want to live your life. And that can be something that is that flower arranging, or the knit and natter, or the book club, which are just as important health interventions as the service-led ones, and that then also allows us to address stigma around health inequalities. A walking group is for everybody. You know, how can we be a little more discreet about some of the way we do interventions around physical activity and those kind of, you know, targeted things? How do we soften that a bit to make it more accessible, and where it's in amongst that wider community mixed offer that people feel safer engaging with, rather than it feeling like, actually, I'm a bit vulnerable and I don't want to put myself into that thing with that headline. I'll find my starting point, which is empowering for individuals.
I think that that really is a key element in terms of, you know, when you talk to public health, or, you know, the prevention approach to things. I think the key aspect is always that we don't see things as a bolt-on, and that we don't just do it for a, you know, to try and be healthy purpose. It's about it, you know, embedding kind of these things in our lives. And I think if it is things like reading clubs and flower arranging, they're hobbies that you do out of enjoyment, and, you know, it's not just about going to a club. It might be something that you then take back and share with someone that you know, and it's not just about thinking, right, I'm going to be healthy on one night a week. I've been to a club, so I'm healthy. It's about, you know, it should be a thread through your life. It's just a bit, you know, it's a bit like doing exercise, I guess. If you embed it in your everyday routines, rather, it's not about going to the gym 3 times a week. It's like, you know, walking to the bus, or you know, doing some gardening or walking your dog. It's just about these kind of things. We want people to be doing the things that keep them well and happy and physically well as well. To, you know, we want them tied into people's lives.
Yeah. So they live their best lives, local to where they are, in the way they would like to live.
I do like that. There's a big thing about living your best life at the minute. It's like hashtag live my best life. So, but yeah, it's true though. It's helping people to, you know, it's enrichment in their lives. It's to get the most enjoyment out of it in the best way they can to keep themselves well and connected.
So it might be that, you know, someone hasn't had the best opportunities in life, and so they therefore wouldn't consider other opportunities that someone else would expect as an opportunity. So it's about, you know, giving people the resources and the opportunities to see that there are, you know, they can have some expectations and aspirations as to what they want out of their lives as well.
There's something really important in the communication of what we are all trying to do, and that's why the community-led elements to it are so essential. Otherwise it will be wrong, because this isn't about doing two, it's about us leaning into communities. And how does that work for you? How might we, do you think this is a thing that we should look at together, and really gentle, which is why, you know, that time that it takes, that relationship building, that trust, trying different things, and not having a one size fits all, because it has to be something that is meaningful and appropriate to the community themselves, and that's hard because we say, well, that's a good intervention for physical activity, 3 sessions a week at the gym. Well, yes, it is, but if that's not what somebody wants, we can offer that free pass forever. So we've got to work harder and listen harder, dig deeper, and co-locate more. Use our community cafes, open the conversations, wear our lanyards, which and say, have a chat with us about this. Tell us what's going on, what else, and if somebody does give us the privilege of listening to them, really listen, and then say, can I come back to you and listen a bit more, and build that dialogue and have a system that leans into that dialogue well, and then I think we'll uncover just some tremendous gains for everybody.
If you're going too quickly, you're not building those relationships. They take time. It takes time to learn about someone. It takes time to learn about community, cultures, So it's a really long journey, but one which sounds very interesting and very exciting.
Watch this space.
So, well, thank you very much for joining me today. That's been fantastic. Wish you all the best. Thank you.